Hi, this is a pleasure to join you today, and I really appreciate the invitation by Dr. Frank to participate in this course. I am Mona Sarfaty. I'm a family physician, and I'm also trained in public health. And I have spent years taking care of patients and also many years doing policy and thinking about how the public policy that we put in place impacts people's health. And for about the past 10 years, I've been very focused on climate change and what it means for people's health. I am going to be talking about how to cover climate change and health. And you can see there on the screen, our Twitter handle is @docsforclimate. And our website is docsforclimate.org. And I'm the director of the Medical Society Consortium on Climate and Health. So we started by surveying physicians to find out what they knew about climate change and whether they felt that climate change was relevant to people's health. And we found out that yes, they knew that they felt that climate change was directly relevant to health, and that many of them, more than half, were seeing their own patients who had what they felt were impacts from climate change. That half of the doctors said that climate change was impacting their patients' health to a great extent or a moderate extent, and another 20% felt that climate change was impacting their patients' health at least a little. And they felt that they had a responsibility to educate their patients about this and also to educate the public. And they wanted to know more, so they wanted what we call continuing medical education for themselves and for medical students. And they felt that physicians should be involved and even leading on environmental sustainability in their workplaces, and they wanted their own professional societies to speak out. So from our perspective, we felt we needed to understand why physicians should be involved in this issue. Of course, the fact that they were seeing people who were impacted was a strong reason, but there were other reasons. And one was that they are very trusted by the public. In fact, doctors and nurses and pharmacists are some of the most trusted professions that there are. And at the other end of the spectrum, at least in the United States, are members of Congress, lobbyists, and salespeople. So especially used car salespeople. Doctors are used to speaking to people about scientific issues, so they are used to translating science to the public, and thus they're in a good position to have these conversations. So the first step for us, after we did this surveying of doctors, was to form a little association. We call ourselves the Medical Society Consortium on Climate and Health. And we released the report that you see there on the screen, Medical Alert, Climate Change is Harming Our Health. This is still available online in electronic form, and it's an excellent summary of the effects that climate change has on people's health, and also has stories of several physicians and how they personally were affected or how their patients were affected by climate change. When we established our association, we agreed that our mission would be to organize, empower, and amplify the voices of America's doctors to convey how climate change was harming health and how climate solutions could improve it. So we wanted to inform the public and inform policymakers about the health harms of climate change and the health benefits of climate solutions. We developed some key messages, which were tested to make sure that they were clear and effective. And the messages emphasize the role that climate change plays in human health. So climate change is not just about polar bears, plants, and penguins. It's really about people, and it impacts people very directly. And so our key messages are that climate change is harming the health of people today, all over the United States and all over the world, due to more extreme heat waves, drought with longer fire seasons, crop losses, more intense storms, spread of diseases from ticks and mosquitoes, and mental health effects that go along with these problems. Everybody is at risk from these impacts, but climate change is harming some people more than others. And those who are harmed first and worst include children, because they spend more time outside, pregnant women, because it turns out that pregnancy makes one especially vulnerable to heat and to poor air quality. And in fact, heat and poor air quality can predict premature deliveries, which can be quite damaging to the babies and to the mothers. Um, the people who are more likely to be harmed worst also include elders, people with chronic cardiac and respiratory conditions, poor people, and many communities of color. And this situation will continue to deteriorate unless we can respond fairly quickly. So this situation is serious, but it's not hopeless, and we know what we need to do. We need to decarbonize our economy by moving to clean energy, energy efficiency, and clean sources of transportation. We need to draw down the carbon that's in the atmosphere with better soil health, with more tree planting and other approaches. And we need to make our countries resilient so we can withstand the realities that are confronting us from climate change. And the sooner we do this, the sooner our air and water will be cleaner and the healthier we will be.
So here we have the solutions part of the solutions journalism. You can see that these are number 4 talks about successful solutions that have been used in many places and that could be applied in your current context. And then number 5 is the call to action. It's the way that we get people moving and doing something to advance the solutions that you put into your journalism. So this is a fabulous example of enacting these principles for this specific outcome, mitigating and adapting to climate change. So, Dr. Sarfaty, please continue with, I think, your story for the next one. Yeah?
Sure. Okay, so this is the story of Dr. Samantha Adut, a pediatrician, whose 11-year-old son Isaac was at band camp playing the clarinet when she got a call from the emergency room and found out that Isaac had collapsed while playing the clarinet. And they rushed to the emergency room. She and her husband rushed to the emergency room, and they learned that their son had experienced heat illness. And it turned out that that particular day was an especially warm day with a solid high humidity. And the heat index had reached over 120 degrees. For her, this was a wake-up call, and she realized that the warm days that she remembered as a child were not like the warm days that children are experiencing today, that it was more intense today, and that the parents that she speaks to when she cares for children in her pediatric practice probably would not know this. And this was the beginning for her of getting entirely involved in working on climate change. And she's now one of our most active advocates for solutions to climate change. So she did a little research and she found out that even where she was in the state that she lives in the United States, that a very large percentage of those who were coming to emergency rooms for heat illness were in fact children. And kids don't regulate their body temperatures the way adults do. So they spent more time outside, and so they were at greater risk. Also at greater risk, as I mentioned before, are pregnant women, those who work outside and are laboring in intense heat, and people who may have chronic lung or heart diseases, and elders. So there are, many stories out there about people who were in these situations who were at risk for heat illness, and some of whom have already experienced heat illness. The next story I'd like to share is of Dr. John Meredith, who's an emergency physician who works in the southern state of North Carolina at a university. And he was there when there was a massive fire that was pouring smoke into many counties of the state. He was in the emergency room and he thought that he was seeing more people who had heart and lung disease than usual. And so he contacted some colleagues and they all decided to actually try to collect the data to find out just how many people were presenting to emergency rooms with problems with their lungs and their hearts. And so they collected this data and they looked at counties that had received much of the smoke plume and counties that had not received the smoke plume, and they found a significant difference. And these pictures here, satellite pictures and then a map, show how much of a difference there was in the smoke plume depending upon where people were. And they discovered that those counties with the smoke plume had a much greater presentation of lung problems in the emergency rooms. So that was pneumonia, bronchitis, exacerbations of asthma or chronic lung disease. And also they had a larger there were a larger number of people who presented with problems with their hearts, including worsening heart failure and heart attacks. So for him, this was a very dramatic illustration of how climate change can impact health, and came together with what he was seeing himself in his emergency room.
So y'all can see how Dr. Sarfaty explained this in a way that made it really clear how there was an observation, such as one that you might make as a journalist, and then a testing of that hypothesis by looking at these data. And I wondered, was there coverage of this? And were they was there any policy change or any social movement as a result of having done this?
That is a good question. And, one thing that changed was that Dr. Meredith also became somebody who was very concerned about climate change, a physician who started to speak to his colleagues and inform others about this. And there have been policy changes in North Carolina in an effort to clean the air. They at one time had many coal burning plants. And the legislature did pass a Clean Carolina Act, and they have pretty much phased out coal as a source of energy in North Carolina. So there has been change there.
Yeah, that's a really familiar story, having worked with Physicians for Social Responsibility in Georgia, with the Southern Company to get more scrubbers on coal burning power plants for exactly the same reason. And the media played an enormous part in that. This happened because they showed up for press conferences that we had. They reported with solid science and with good stories. And we really managed to make a difference with, again, solutions journalism and good advocacy that was science-based. So excellent. Good to know that that helped there as well. Please
Yeah,
continue.
definitely. Okay, so this is another really interesting story of Dr. Claude Tellez, who is a retired critical care physician in Louisiana and was there in 2016 when there was a tremendous rainstorm. They called it a 1,000-year flood event, and you could see how much of the state of Louisiana in fact did flood. It was about 30% of the state. There was so much rain that fell. There was, like 20 inches in a very short period of time, which is a huge rainstorm. And it was a terrible natural disaster. People died. The Coast Guard had to rescue 30,000 people. 10,000 ended up in shelters. And the governor declared a state of emergency. Many homes and buildings were damaged. And Dr. Tellez describes how many months later, there were pieces of appliances and washing machine, including washing machines and chairs and furniture piled up on roadsides that still had not been carted away. He got involved in trying to help people with other physicians in coordinating with pharmacies and making sure that people who had been evacuated got the medications that they had left behind at home when they left their homes. And so they were able to help a lot of people who had high blood pressure, heart problems, diabetes, and so forth. so that they still had the medications that they needed. Many months later, teachers confided in Dr. Tellez that the children were so frightened that every time it rained after that, they were terrified because they thought it might flood again. So this says something about the lasting mental health impacts that children, and in fact all people, can face after such situations, after such emergencies.